Mark Klimek Review, Prioritization and Delegations and Staff Management. Prioritization: decide which patient is the sickest and the healthiest. Age, gender, diagnosis, and modifying phase. Most important, age and gender are irrelevant. Only pay attention to age in pediatrics. Rule 1. Acute beats chronic. Example, appendicitis, COP, CHF. The higher priority is the appendicitis patient. Rule 2. Fresh post-op 12 hours unless beats medical or other surgical. Example, 2-hour post-choley will beat anything else, no matter what the procedure is if you aren't under 12 hours and you are not more important. Rule 3. Unstable beats stable. Things that make a patient stable, ready for discharge: to be discharged, admitted longer than 24 hours ago, unchanged assessments, experiencing the typical expected signs and symptoms of the disease with which they were diagnosed, use of the word stable, chronic illness, post-op greater than 12 hours, local or regional anesthesia, lab abnormalities of an A or B level. Things that make a patient unstable, not ready for discharge, newly admitted, newly diagnosed, admitted less than 24 hours ago, changed assessments, experiencing unexpected signs and symptoms, use of the word unstable, acute illness, post-op less than 12 hours, general anesthesia within the first 12 hours, lab abnormalities of a C or D level. 4 things that make you unstable always are: hemorrhage, high fevers over 105, can cause the patient to seize, hypoglycemia, low blood glucose, pulseless or breathless, only low priority at the scene of an unwitnessed accident. 3 things that are labeled a black tag in an unwitnessed accident: pulseless, breathless, and fixed and dilated pupils. Rule 4, tiebreaker, the more vital the organ the higher priority. Order of organs, highest to lowest priority: brain, lung, heart, liver, kidney, pancreas. Delegation: a RN cannot delegate LPN to start a 4, hang or mix 4 meds, pushing 4 push meds, can maintain and document the flow of a 4 med, cannot administer blood or mess with central lines. No flushing or changing the dressing, cannot plan care. Only RN can do a plan of care, the LPN can implement it, cannot perform or develop teaching, can reinforce teaching, cannot take care of unstable patients, cannot do the first of anything, the RN do assessment and care plans first, then the LPN cannot do the assessments of admission, discharge, transfer, or the first assessment after there has been a change. The RN does the assessment after a change. Do not delegate these to app, tech or aid. Charting, can chart what they did but nothing about the patient, cannot give meds, except for topical, OTC, and barrier creams, cannot do assessments, except for vitals and Acute checks, always DROWN versus an Acute checks, cannot do treatments, except for enemas, cannot catheterize a patient, cannot do the first of anything. You can delegate an aid to. ADLs do not delegate safety to the families. The family can help with care once they are taught and the doctor okays it. It must be documented. Nurse management: when do you intervene when a staff member is being inappropriate? Always ask yourself, is what they are doing is illegal? Yes, tell the supervisor. Is anyone, the patient or staff member, in harm's way? Yes, confront immediately. Is this behavior legal? Not harmful but simply inappropriate? Yes, approach them later and counsel them. Know your quadrants with the body systems and the heart valves. Aortic, 2 intercostal space at the right sternal border and D pulmonic, 2 intercostal space at the left sternal border and D tricuspid, 4 intercostal space at the left sternal border TH mitral, 5 intercostal space in the midclavicular line TH. Quadrants. 4, know which organs are in what quadrant. Know where the pulses are located. Guessing strategies, knowledge. Common sense guessing strategies. FIS questions. The nurse will examine their own feelings about something. Establish a trust relationship. Nutrition questions. Anytime pick chicken first, nothing fried, fished, no shellfish, Never pick casserole for children. Never mix medication in a child's food. Always ask permission to mix meds and food. Toddler foods, finger foods. Toddler can choke on hot dogs and popcorn. Preschoolers, leave them alone. One meal a day is good. They aren't growing how they were before in a toddler stage. Pharmacology questions. Amikacin, treats infections. Antibiotic, for piggyback. Remember side effects. Do not remember dosage, frequency, and routes. If you know what a drug does, but do not know the side effects, pick a side effect in the same body system where the drug is working. Example, GI med diarrhea, cardiac tachycardia, CNS med drowsiness. If you have no clue what the drug is, look to see if it's pick a GI side effect. Never tell a child that medicine is candy. Ob/kin. Check fetal HR med surge. First thing to assess is the level of consciousness. First thing to do if you are guessing, establish an airway. Pediatric growth and development. Always give the child more time to grow and develop. 1. When in doubt, call it normal. 2. When in doubt, pick the older age. 3. When in doubt, pick the easier task. General, rule out absolutes. If two answers say the same thing, neither answer is right. If two answers are opposite, one of them is probably right. The umbrella strategy, an answer that covers all the others without saying it. If the question gives you 4 right answers, prioritize. When stuck between 2 answers, go back and reread the question. Sesame Street rule, only remaining option when nothing else works. Wrong answers share things in common. The right answer is unique. Do be tempted to answer a questions off your ignorance versus your knowledge. If something feels right, more than likely it is. Don't change your answers if the other answer is not superior. 3. Expectations you are not allowed to have. Negativity will make you fail. 1. Do not expect 75 or 85 questions. Expect 265 questions. Set your brain up for the entire exam. 2. Do not expect to know everything. 3. Do not expect everything to go right.